I think for me, first and foremost, is the humanization. People understanding that people are people. It sounds so simple, but I think particularly when someone's really unwell, it can be really hard to see them as a person in some ways. I also think that we really need to acknowledge and engage with lived experience. And when someone is talking about what their lived experience is, not to dismiss them, but to instead try and work with that to come up with a solution. I think, unfortunately, because of the way mental illness presents, lived experience isn't quite accepted in the way it is in other disabilities, for example. And I think if we can humanize people and if we can understand that their lived experience is valid, that's a great first step, I think, towards removing some of the barriers that we face at the moment. I think for me, actively engaging with mental health advocates and people who engage with mental illness and really deeply showing that you support those organizations is a good first step. I think also shifting from a reactionary perspective and instead allowing people with these conditions to sort of lead conversations is another great way to sort of instigate some of those changes. I think a lot of the time, unfortunately, people are spoken over. And because of that, even if it's well-intentioned, sometimes the wrong things change essentially. And so I think actively engaging and actively silencing so that we can hear the right voices. For me, those are the most important steps at this stage, yeah. So for me, that would be quite recently. I sort of approached a friend who I was really awful to before I had treatment. And we'd gone traveling together and I was really unwell and I was really cruel to her, to be very frank. And I had wanted to apologize to her for so long, but I just couldn't find the words because I was so ashamed of what I'd said and what I'd done. And so the last time we met up in person, I said to her, "I'm really sorry." And she didn't even accept the apology because she said, "Well, that wasn't you." And so I can't be angry at you, and I was never angry at you because that wasn't you. And I'm just so glad that you're getting the support you need now. And for me, that was just so relieving and so wonderful to hear that people understood that when I was acting in a way that wasn't myself, it truly wasn't me. And I think for me, that sort of gave me a lot of hope for the future as well. That if I got sick again, I wouldn't be abandoned by people, because that's a big fear, that when you get sick, people will stop loving you. And to understand that I was deserving of love even when I'm unwell, that was huge for me. Yeah.